This is a contrast CT scan of a 75 years old female patient. She is a known case of hepatitis C and hepatic cirrhosis. She has developed hepatocellular carcinoma for which triphasic CT scan was advised. Now please, this is the arterial phase. Please observe these enhancing nodular lesions. These are the metastatic lesions in right lobe of liver. As I scroll it down, now this is the mass lesion here. This shows non-homogeneous enhancement. This basically is the hepatocellular carcinoma. Rest of the nodular lesions like this one and the lesions that I have shown you earlier, these are the intrahepatic metastasis. Now please make a note of this thrombus, tumor thrombus, which is extending into the right branch of portal vein. This shows enhancement pattern similar to that of the hepatocellular carcinoma. Now this extends into the left branch of portal vein as well. Now both of these are almost completely occluded. Tumor thrombus also extends into the lateral part of portal vein itself. This one here. There are certain reasons why I have chosen this case. Although you must have come across many such cases of hepatocellular carcinoma with the tumor thrombus extending into the portal vein. It shows some significant and normal enhancing pattern in the arterial phase. Now I will show you the portal venous phase. Now this is the portal venous phase. Ideally, the metastatic lesions as well as the primary lesion wash off would have occurred, but there is no wash off and the contrast medium is still present in the primary lesion as well as in the metastatic lesions. So it is not always necessary that wash off will be there in the portal venous phase. There is central area of necrosis here. Tumor thrombus with a similar enhancement pattern extending into the right branch and left branch of portal vein. Now please observe that this is the bland thrombus here. This is a blood clot at the tip of the tumor thrombus. You may call it a bland thrombus. Now this is the portal vein itself. Now I will show you the spiromesenteric vein. This is spiromesenteric vein. Now since a thrombus is there, so this is partly opacified. Please do not be misled that this probably is also a thrombus. It is not a thrombus. I will show you this in the delayed portal venous phase. Now it's always wise and recommended to look for the metastatic lesions around. Now for example, this is a lymph node here. This is a metastatic lymph node lying posterior to the portal vein. This another is a metastatic lesion which has involved and is infiltrated the anterior part of left psoas muscle. So please do not be contented upon finding metastasis only at one place. Always look for the metastasis at other places as well. Now these two are also the metastatic lymph nodes, these one and this one here. This is the delayed portal venous phase. Now please observe that wash off has occurred and most of the metastatic lesions, these have become hypodense. This one here, this one here, this one here, this one. The main mass lesion, although this still is hyperdense as compared to the adjacent hepatic parenchyma, but the CT density of its solid component in this was approximately 92 HU, while in the portal venous phase it was approximately 121 HU. This is the bland thrombus here, this one showing no enhancement. Now please observe that the superior mesenteric vein, it has enhanced normally, so it was not thrombosed. Please observe the moderate osteoporosis, moderate degenerative spondylosis. DV12 is partially compressed, most probably because of the effects of trauma and the osteoporosis. Now please observe that there is spondylolysis at the level of LV5. This one here. There is grade 2 anterolysis of LV5 over SV1. This is the break in the pars interarticularis at this level. Now, since the patient has got scoliosis, so please do not be misled that this is a case of discitis. It is not a case of discitis. On the side of concavity, disc space is reduced and there is sclerosis of the adjacent margins. So this should not be confused with the discitis, because as I go towards the other side, the vertebral height, although disc space is reduced, but the vertebrae, they are just normal.